9. OSH Management Systems Deck 03. Definition of terms. Management. The art of getting things done, management theorist, Mary Parker Fallon. The process of planning, organizing, leading and controlling the efforts of organizational members and of using all other organizational resources to achieve stated organizational goal. Management educators. OSH management. A systematic and systemic process of planning, organizing, controlling, reviewing, and leading the actions and behavior of the operation such that risks, loss and danger to the person or the organization is efficiently avoided or mitigated. OSH management system. An occupational health and safety management system, OSMS, is a coordinated and systematic approach to managing health and safety risks. OSMS help organizations to continually improve their safety performance and compliance to health and safety legislation and standards. In doing so, they establish safer working environments that protect people at work by eliminating, or better managing, health and safety hazards. Benefits of an OSHMS. An OSMS can benefit any organization, no matter how small or large, by helping organizations create safer work environments, reducing injuries and injury-related costs by preempting injuries. Employers save money on medical expenses, the injured employee's wages, insurance claim excesses, replacement labor, and increased workers' compensation insurance premiums. Improving business opportunities. Many companies have preferential purchasing policies that favor purchasing products or services from companies within OSMS. Providing measurable systems that can verify OHS performance. Demonstrating that the organization is meeting legal requirements, and enhancing the organization's reputation. Research shows that there are clear links between good OHS management systems and long-term business efficiency. Features of an effective OSMS. Have top management commitment to managing OHS risk. Top management must demonstrate OHS leadership and promote the involvement of staff in the development and implementation of the OSMS. Be supported by the organization's overall management system. The organization must provide corporate commitment and sufficient resources. Make the OSMS's structures and processes visible to employees and relevant to all business activities all the time, and ensure that OHSMSs are regularly updated because OHS risks can increase at busy times, or when changes are occurring, e.g. during restructures, changes of products and services, changes of suppliers. The OSMS needs to adjust to, and be appropriate for all circumstances. Features of OSHMS. Proactive and or reactive. Systematic. Systemic. Discrete and or continuous. Holistic and or atomistic. Open-ended and or close-ended. The 5 steps of an OSMS. 1. Top management commitment and POLIC. The policy is a general plan of intent which guides or influences future decisions. It is the basis upon which measurable objectives and targets and the OSMS is developed. 2. Planning. Plan how to deliver the OHS policy, objectives, and targets to ensure hazards arising from work activities are identified so that risks can be assessed and then controlled. Main aspects of OSHMS and OSHMS in relation to other aspects of management. Legislative, technical, behavioral, environment, OSHMS. ASCII. Alt. The organization goal, objectives, mission rightward arrow risk management, SAFETLY management, financial management, human resource management, marketing management. ASCII. Alt. Styles and approaches to OSHMS. Behavioral approach. Require all levels of management to incorporate safety to decision making. Existence of. Fire Safety Note 26. 6. Materials handling. Styles and approaches to OSHMS. Behavioral approach. Require all levels of management to incorporate safety to decision making. Existence of steering committee to coordinate safety matters. Quality circles to discuss interplay between safety, health, environment, quality, and production. slash 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 setting of performance indices slash philosophical approach. Investigate all unsafe practices and incidents. Safety off the job is as important as on the job. Safety first. Good safety and health is good business. Styles and approaches to OSH slash corporate approach. Integrating safety to day-to-day responsibilities of corporate officers and staff. CEO is ultimately responsible for safety. Involving OSH staff to ensure that production and quality slash participative approach to safety. Socio-technical approach. Wider and open-ended approach that links OSH into social and natural environment. Usually applied to the study of man-made disasters. Systems approach. Considering the following structural elements such as groups, committees, reporting systems. Processes are more dynamic action, problem solving, information. Interconnections between parts, the systems, and feedbacks. External influences, laws, economy. OSHM's different systemic approaches. HSG 65, Successful Health and Safety Management. What constitutes a successful OSHMS? Consideration of the UK approach. HSG 65 is considered. HSG equals POPMR, Safety Policy rightward arrow Organize, Safety Culture, rightward arrow Planning rightward arrow Monitor rightward arrow Audit and Review. ASCII. Alt. Alternative approaches to HSG 65. BS 8800. It is an integrated model combining HSG 65 and ISO 14001 SHE. It is an open system, allowing for economic, political, and global influences, unlike HSG 65, which is a closed system. Is proactive, aimed at small and medium-sized organizations, many of whom have heard of BSI but not house approaches, and who regard the former as having a commercial payoff during tendering, as we have seen with BS 5750 in the past. BS 8800 is a non-endorsable system. You cannot display BS 8800 logo as you can a BSS 750/ISO 9001. External and internal factors. Rightward arrow Initial SHE Policy Review, rightward arrow SHE Policy, rightward arrow Organize for Safety Culture, rightward arrow Planning, rightward arrow Monitor, rightward arrow Audit and Review. ASCII. Alt. OSHAS 18001/2. Certifiable by e.g. BSI but not the same status as ISO, yet. Based on HSG 65. Requires more detailed procedures and evidence. Creates a paper trail and requires continuous updating, a live document. Safety policy rightward arrow planning rightward arrow implementation and operation rightward arrow checking and corrective action rightward arrow management review rightward arrow continuous improvement. ASCII. Alt. ISO 14001. IOHA. IOHA produced a generic universal systems model based on the assessment of the 24 OSH/MS standards, the 15 countries etc. ASCII. Alt. ASCII. Alt. Barriers in the development of OSH/MS. External barriers, environments. Internal barriers, within the organization. ILO draft guidelines on OSH/MS. Policy, 1. OSH policy, 2. Worker participation, organizing, 1. Responsibility and accountability, 2. Competence and training, 3. OSH/MS documentation, 4. Communication, evaluation, 1. Performance measurement, 2. Accident, disease, and incident investigation, 3. Auditing, 4. Management review, planning implementation, 1. Initial review, 2. OSH objectives, 3. System planning, development and implementation, 4. Hazard control, hazard/risk controls, management of change, emergency preparedness and response procurement and contracting, action, 1. Preventative and corrective action, 2. Review and back to organizing, continuous improvement. ASCII. Alt. Objectives: to contribute to the protection of workers from hazards and to the elimination of work-related injuries, diseases, and death. At national level. To be used to establish a national framework for OSH management systems, preferably supported by national laws and regulations. To provide guidance for the development of voluntary arrangements to strengthen compliance with regulations and standards leading to continual improvement in OSH performance, and to provide guidance on the development of both national and tailored guidelines on OSH management systems to respond appropriately to the real needs of organizations, according to their size and the nature of their activities. At the level of the organization. To provide guidance regarding the integration of OSH management system elements in the organization as a component of policy and management arrangements, and to motivate all members of the organization, particularly owners, managerial staff, workers in applying appropriate OSH management principles and methods to continually improve OSH performance. National Framework for OSH. National Policy on OSH Management System. Competent institution. Should establish general principles and procedure to promote the implementation and integration of OSHMs. Facilitate and improve voluntary arrangements for systematic identification, planning, and improvement of OSH activities at national and organization levels. General principles and procedures can't promote the participation of workers at organization level. Implement continual improvements while avoiding unnecessary bureaucracy, administration, and costs, and evaluate the national policy and framework at appropriate intervals. Competent authority, responsible to formulate, implement, and periodically review a coherent national policy for the establishment and promotion of OSHMs in organizations. Act in consultation with the most representative organizations of employers and workers, and with other bodies as appropriate, and competent authority, responsible to make arrangements and provide technically sound guidance to labor inspectors, OSH services, and other public or private services, agencies and institutions dealing with OSH, including healthcare providers, to encourage and help organizations to implement OSHMs. National guidelines. Tailored guidelines should be designed considering the company's size, large, medium, and small, and infrastructure and the types of hazards and degree of risks. Employer's responsibility. Strong leadership and commitment to OSH. Main elements of OSHMs. Occupational safety and health policy. Specific to organization dependent on its size and nature of activities. Concise, clearly written, dated and signed. Communicated and readily accessible. Reviewed for continuing suitability. Made available to others. Workers' participation. Essential element on OSH policy. Workers be consulted, informed, and trained. Time and resources for active participation. Organization of Safety and Health Committee. Organizing. Responsibility and accountability. OSH as employer's overall responsibility. Allocation of responsibility, accountability, and authority. Competence and training. Necessary competence requirements. Education. Work experience. Training. Combination of the above. Training program should cover all members. Conducted by competent persons. Timely and refresher course. Evaluation of participants. Reviewed periodically. At no cost. OSH-MS documentation. OSH policy and objectives. Allocated key OSH management roles and responsibilities. Significant OSH risks and hazards. Arrangements, procedures, and instructions. Records. Records arising from OSH management implementation. Records of work-related injuries and illnesses. Records of compliance to the laws on OSH. Records of workers' exposure. Records of monitoring. Communication. Appropriate receiving and responding. Internal communications at all levels. Concerns, ideas, and inputs of workers. Planning and implementation. Lishal review. OSH-MS and other arrangements evaluation. Be carried out by competent persons. Should include. Identify current laws. Identify, anticipate, and assess hazards. Determine the adequacy of corrective actions. System planning, development, and implementation. Adequate and appropriate OSH planning based on the result of initial review. Clear definition, priority setting and quantification. Preparation of a plan to achieve objectives. Selection of measurement criteria. Provision of resources. OSH objectives. Specific to organization. Consistent with relevant standards. Focus towards continual workers' protection. Realistic and achievable. Documented and communicated. Periodically evaluated. Hazard prevention. Prevention and control measures. Hazards and risks be identified and assessed. Eliminate the hazards. Minimize. PPE. Management change. Impact on OSH changes, internal and external, be evaluated. Emergency prevention, preparedness, and response. Information dissemination to protect people. First aid and medical assistance training and drills. In cooperation with external bodies. Procurement. Compliance to OSH standards prior to purchasing. Contracting. OSH criteria in selection. Reporting. Awareness on OSH. Evaluation. Performance monitoring and measurement. Procedures be developed, established, and periodically reviewed. Selection of performance indicators. Monitoring. Feedback on OSH performance. Day-to-day information. Proactive monitoring. Achievement on plans. Systematic inspection. Surveillance on working environment. Compliance to laws. Reactive monitoring. Identification, reporting and investigation. Work-related injuries and diseases. Damage to property. Deficient OSH performance. Workers' rehabilitation. Accident investigation. Identify causes and failures in OSH-MS. Competent person. Corrective actions. Documentation. Audit. Elements are in place, adequate and effective. Competent auditors. Contents. OSH policy. Workers' participation. Competence and training. Responsibility and accountability. Prevention and control measures. Management change. Emergency preparedness. Management review continual improvement. Management review. Evaluation of overall strategy and OSH-MS ability to meet needs. Feedback direction. Evaluate effectiveness of previous reviews. Action of improvement. Preventive and corrective actions. Identification of root cause of accident. Review of inspection reports. Hierarchy of prevention. Continual improvement. New relevant information result of health protection and promotion programs. Changes in standards. Outcome of management reviews.